Hey guys, Matt, Germain again, back to Balance Wellness Centers. So we're going to go to the next part of this little lesson or instructional video, whatever you want to call it. And by the way, always remember, if there's ever anything that you have questions about, don't hesitate to ask myself, call the staff, we'll make sure you get the answers that you need. In addition to that, if you have other health practitioners, doctors, physical therapists, other chiropractors, medical people, whomever, you're always welcome to ask questions about something that you're not positive about, okay? And if there's ever any pain or discomfort with anything that we're about to show you, by all means, stop immediately and give us a call, okay? So we're gonna get into some of the stretches. Now, this is the fun part, right? Because this is the stuff that you can do every day. Now, I'm very lucky that I've got an assistant to help me show you some things, and if you're like me, it's always more fun to have somebody to help you with any of this kind of stuff, especially stretching. Stretching is magnificent when you have somebody that can help you, but we don't always have somebody to help us stretch. So we're gonna first show you some things that you can do with a friend or a family member, and then we're gonna show you some things when you are by yourself, or if you're in a hotel room, or if you're traveling, things that you can do every single day to help prevent issues from happening, whether you have either acute problems or chronic problems. Acute means just happened. Chronic means over a long period of time. So we're going to start with a very simple hamstring stretch. Now what you have to remember, some of these stretches I'm going to show, all the muscles connect into what's called your pelvis or your ilia. These are the bones that you walk on, right? Every time you walk, every time you march, it's your hip flexors and your gluteal muscles, your hamstrings, and your quadriceps. So those are the ones that we're going to focus on because they all have connections to your knee and to your, basically your middle back, your low back, or your pelvic rim, which is this area back in here. So the first thing we would do is bring the person's leg, okay, just let it relax for me. And you always want the person to be relaxed because if they're holding their muscles, it's gonna be tight and then you can cause a pull. So she's got her leg completely relaxed, and all I'm doing is I'm supporting above her knee joint, got my other hand on her ankle, and we're just very simply bringing it up to wherever she starts to feel a pull. Can you tell me when you feel a pull? About there? We have somebody who's flexible, so that's not helping us with our, well, that's good there. So we start feeling a little pull. I can tell a little bit, and then she vocalizes to me that she's feeling it pull a little bit. So that happens, we want to basically hold it for about 10 to 20 seconds, and depending on the person's, obviously their comfort level. And then what I like to do is I like to bring the leg out just a bit, so I just moved it out maybe a half an inch. And then I move it forward again, you feel a little bit of a different pull, right? So again, this is not something you'll be able to do yourself necessarily, but you can bring out just a little bit more and stretch. So that's a very simple stretch you can do. Let's bend your knee. So now if you are, again, assisting somebody, one thing you want to do is bring knee to opposite shoulder. Now she could very easily grab her knee and bring it to the opposite shoulder. You never want to bring it to the same shoulder, okay? Always the opposite shoulder. And what this is going to do is it's going to stretch the gluteal muscles, some of the hip flexors too, but go ahead and let go for me. So what I like to do is I turn the foot in just a bit and then bring the knee over. Do you feel that a little bit more than when you're doing it? So where she's feeling it is in her glutes and into her low back. And I always have a little bit of a saying, your low back always goes as your glutes go. So if we keep the glutes nice and loose, the low back will be loose as well. So if you're by yourself or whatever, and I'll show you how this works when you're by yourself, great stretches, okay? There's one that a lot of folks like to show, which is knee to same side shoulder. It's not one I prefer. I myself have suffered from low back issues for my entire life. It's not something that's ever felt good for me, so I'm not gonna teach it. But again, if some other health practitioner thinks it's good for you, by all means, you can follow their directions, okay?